Every day, hospitals perform many clinical procedures such as central line insertion, endoscopy, biopsy, dialysis procedures, minor surgical procedures. But imagine if a procedure is performed on the wrong patient, at the wrong site, or the wrong procedure itself is done. These are serious patient safety events. To prevent such errors, NABH introduced the COP-7 standard, which ensures that all clinical procedures are performed safely and in a standardized manner. What you will learn in this video. In this video we will clearly understand what NABH COP-7 standard says, what assessors check during procedure safety review, common mistakes hospitals make, and how hospitals can become COP-7 compliant. Let's begin. What is NABH COP-7 standard? The COP-7 standard states, clinical procedures are performed in a safe manner. This means hospitals must ensure that every procedure is performed with proper protocols, trained staff, safety verification steps. This helps ensure safe and standardized clinical care. Objective elements of COP-7. COP-7 includes several important elements. Clinical need-based procedure decision, written SOP for procedures, qualified personnel performing procedures, prevention of wrong patient, wrong site, wrong procedure, informed consent, monitoring during and after procedures, procedure documentation. During NABH assessment, assessors verify these through hospital policies, procedure records, patient files. Clinical need-based procedures. A clinical procedure should always be performed based on patient clinical condition, standard treatment guidelines. The decision to perform a procedure must be taken by a qualified medical practitioner. If multiple treatment options are available, the decision should consider best clinical outcome, patient safety, patient preference. Clinical audit of procedures. Hospitals may conduct clinical audits of procedures to improve outcomes. This helps identify procedure complications, opportunities for improvement. Clinical audits are an important tool for quality improvement in patient care. Written guidance for procedures. Hospitals must maintain written SOP or protocols for procedures. These guidelines apply to diagnostic procedures, therapeutic procedures, supportive procedures. A procedure SOP should clearly define who will perform the procedure, pre-procedure instructions, procedure steps, post-procedure care. Pre-procedure assessment. Before performing any procedure, basic patient assessment must be done. This includes vital signs, patient condition review. This ensures that the patient is clinically stable for the procedure. Safe equipment use. All equipment used during procedures must be properly functioning, used safely. Equipment malfunction can lead to serious patient safety risks. Qualified personnel. Clinical procedures must be performed by qualified and privileged staff. Hospitals must implement a privileging system to ensure that doctors performing procedures are authorized, assisting staff are properly trained. This ensures safe procedure performance. Prevention of wrong patient, wrong site. One of the core requirements of COP-7 is preventing wrong patient, wrong procedure, wrong site. Hospitals should use pre-procedure safety checklists. These checklists may be based on WHO Surgical Safety Checklist, Modified Hospital Safety Checklist, patient identification. Before performing a procedure, hospitals must verify the patient using at least 2 identifiers. Examples include patient name, Unique Hospital Identification Number, UHID. This helps ensure the correct patient is treated. Site marking. For certain procedures, hospitals must implement site marking systems. This helps ensure the procedure is performed at the correct anatomical site. Team responsibility. Verification of the correct patient, procedure, and site is the responsibility of the entire procedure team. However, the ultimate responsibility lies with the performing doctor. Training situations. If a procedure is performed by a trainee doctor, the supervising clinician remains responsible. This ensures patient safety during training procedures. Emergency procedures. In emergency situations, it may not always be possible to complete all safety checks. However, hospitals must still perform maximum possible safety checks. Any exceptions must be documented in the medical record. Patient participation. Patient participation is encouraged in safety processes such as site marking. Involving patients or family members improves safety verification. Informed consent. Before performing any procedure, informed consent must be obtained. Consent should be taken by the procedure performing doctor, the treating doctor. If a trainee performs the procedure, this must be mentioned in the consent form. Monitoring during procedures. During the procedure, patients must be monitored. Minimum monitoring parameters include pulse, blood pressure, respiratory rate. This ensures patient stability during procedures. Post-procedure monitoring. After the procedure, patients must be monitored for complications. Monitoring duration depends on procedure complexity, patient comorbidities, procedure documentation. Every procedure must have complete documentation. Procedure documentation should include procedure name, performing doctor, key procedure steps, findings, post-procedure instructions. Documentation must also include doctor name, date, time, signature. Proper documentation ensures clinical accountability and continuity of care. Common NABH non-conformities in COP-7. During NABH assessments, common observations include procedure SOP not documented, pre-procedure checklist not used, incomplete consent documentation, incomplete procedure documentation, weak patient identification process. Hospitals should address these issues to avoid assessment non-conformities. How hospitals can become COP-7 compliant. Hospitals can comply with COP-7 by developing procedure SOP, implementing safety checklists, strengthening consent processes, improving procedure documentation, conducting staff training. These steps help hospitals effectively comply with NABH COP-7 requirements. In the next video of this NABH training series, we will discuss COP-8 transfusion services are provided safely as per the scope of services of the organization. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.